name is I am Damer Umadle, your student from UIFC to BSN 1B. So today I will going to demonstrate how to perform the assessing of the musculoskeletal system of my patient. So the first thing we do is to perform hand hygiene. So let's assume I already washed my hands and provided the client privacy. Now I'm going to proceed asking the various question to my patient. So, good morning, Miss Marlene. Um, is it your name, Marlene? Okay, so today we're going to perform or assess your musculoskeletal system. Is that okay for you?
Yes.
Okay, so first thing I would like to ask you various questions. So, in your family history, or in your history, do you have any problem with your joints, in your muscles?
No.
How about skeletal?
No.
How about during your childhood, did you experience any like condition like broken bones
No.
or any fracture? Okay, so in your family, do you have any a disease like or a condition like arthritis?
No.
Okay, so how about you? Do you have arthritis?
No.
Okay, so thank you so much. So that's very clear for me. So I wanted to ask is your position right now is okay?
Yes.
Okay, so do you want to sit? Okay, so okay, just sit. Can you yeah, you lay down here. Okay, now we're going to perform now assessing your musculoskeletal system. Okay, now we're going to assess your face. I'm going to inspect and palpate, and then to palpate so that I will know if there is any tenderness, swelling, or you feel pain if I palpate it. Is that okay? Okay, I will touch your hands, your face. I mean. Okay, can you please smile? Okay, move your mouth inside, side. How about open your mouth, big mouth. Okay, make your tongue out. Okay, very good. So when I palpate, can you feel any pain or any tenderness? So as I can expect, there is no presence of swelling and any discoloring. So I think my patient's upper extremities, which is the face, is in normal condition. So now we're going to um, what do you call this? We're going to inspect and palpate again the shoulder of my patient. So I will make my patient stand so that I will perform it. Before I palpate and inspect the shoulder of my patient, I want her to stand and I'm going to inspect the spinal cord of my patient. So to inspect the spinal cord of my patient, I will look for or I will going to touch the cord. Can you please okay, your head like that. Okay, so let's check or inspect the C1 to C7. So the alignment is okay. So as I palpate, there is, can you feel any pain?
No.
Okay, so very good. So as I can inspect the C7 of my patient, which is can be seen here or can be feel, it's aligned and there is no bulging thing and I think my patient's back is normal. So now we're going to proceed inspecting and palpating the shoulder of my patient. So okay. So as I inspect and palpate you, can you please move your shoulder up against my hands like this? So if I touch it, you know. Okay, so go. Okay, so I am checking the strength of the shoulder of my patient. Can you please follow my hands like this? Put your hands on your head, back of your head. Okay. Is there any pain? Okay, back like that. Put in your back of your neck. Okay. I am checking the range of motion of my patient. Okay, so very good. So I will going to inspect your hands. So as I palpate this, can you feel any pain?
No.
No pain? Okay, I'm inspecting if there are any presence of any lesions or something strange in her hand. So as I can observe, there is no presence of tenderness, pain, and swelling. So, and also the color of my patient and the temperature of my patient is normal. So, don't forget to check the other side. So, can you feel, is there pain?
No.
Okay, inspect. The color is fine, the temperature is okay. Okay, so now I want to check your joints in your wrist. So I will inspect and palpate all of the joints that can be seen in the wrist. So is there any pain?
No.
Okay, so as I can observe, there is no presence of any swelling, any tenderness, or any abnormalities or enlargement. So as I can say, it's okay. And then don't forget to check the other side. Okay. Is there any pain? Can you
No.
feel any pain?
No.
Okay. So about here. So as I can check the part of the wrist of my patient, there is no any presence of swelling, tenderness, or pain. Now we're going to check the strength of my patient. So I want you to push it like this, and I'm going to do this, and you're going to force it towards you. So okay, I will check your strength. Okay, go. Okay. Sige, stronger one. Okay, okay. How about in your, okay. Okay, the strength is good. So I want you to do this, and up and down, up. Okay, open your fingers, close, again, straight, down. Okay, so I think all of the joints, all the muscles and bones that can be seen in the hands of my patient and the wrist, I think it's all okay. So now I am done assessing your wrist. So I want you now to sit down. So now after we inspect, palpate the upper extremities of, of our patient, which is inspecting the muscles, the joints, and the bones. Now let's proceed assessing the lower extremities of my patient, and let us inspect and palpate the muscles, the joints, and the bones for any abnormalities or any bad condition that may happen to our patient. So let's make our patient comfortable and okay. So I will check your hips here. As I can palpate, can you feel any tenderness
No.
or any pain?
No.
Okay, very good. So okay, here pain. There
No.
is pain. Okay, but here
No.
no pain. Okay, now we're going to perform the range of motion. So I want your feet. Can you open your feet? Okay, very good. Back. Put your up. Okay, is there pain?
No.
I want you to bend. Okay, as far as I go, is there pain?
No.
Okay, now as I can inspect or hear, there is no any abnormal sounds like a sounds coming from the bone. So I think the patient's feet is normal. So again, bend. No. Okay. No. No pain. Not here.
No.
No pain. Okay. So let's don't forget to perform it to the other side. Okay. Pain.
No.
No. Up. Pain.
No.
Bend.
No.
Pain. Okay. So here. Pain.
No.
Not here. Pain.
No.
Okay, no. So I want to check your strength. So as I put, I want you to have a force coming there against my hands. Okay, you understand? Okay, pull, push. Okay, very good. Out here, pull. Okay, the strength is okay. So now let's check the joints of our patient. So let us check here. Let's check every joints that can be found in her feet. Let's inspect and palpate. So can you feel any tenderness or any pain?
No.
So as I can see, there is no abnormality. So here, no.
No.
Okay, so can you close it? Force. Okay, very good. Pull. Oh, push. I mean, okay, good. Pain,
No.
pain,
No.
pain,
No.
pain.
No.
Okay. So let's don't forget to check it the other side. So can you feel any pain?
No.
Let's check the joints of our patient. Okay, there is no abnormalities, and I can see there is no presence of swelling. Okay, check for the strength. Push. Okay, push. Okay, pain,
No.
pain,
No.
pain,
No.
pain.
No.
Okay. So as I can inspect and palpate the musculoskeletal of my patient, overall there is no any abnormalities or any strange condition that I can say. So after we perform, let us not forget to document the findings in the client record. So thank you so much, Miss Martin, for your cooperation. So is there anything I can do to help you? Okay, so thank you so much for your cooperation. So just call me if you need something, okay?
Okay.
So that is how we perform or assessing the musculoskeletal of our patient. So after we document the findings of our patient, so let us not forget to perform the hand hygiene. That's all.